As leaders and advocates for quality advanced care planning, we can shape what person-centered and family-oriented care looks like, and we can inspire change. It starts with us. I became a hospice volunteer when I was in college, which really solidified for me that this career was the path for me. It was through my work as a hospice and palliative care social worker that I was able to walk the journey with people, as well as to see that there's a better way that we can support people on the journey through person-centered and family-oriented decision making. That's partly why I had the opportunity to move from direct service to now providing consultation and education, supporting organizations across the nation on how to be able to design advanced care planning programs and really change the culture, to transform the culture to be person-centered and family-oriented. I'd like to share some measurable results that we have seen in our experience in working with organizations who implement the Respecting Choices model. These programs report increased patient and family satisfaction, improved patient and physician healthcare team communication, and overall better treatment plans that reflect patient goals, which we call concordance of care. This positively impacts the patient experience measures that assess quality of care, such as feeling heard and understood as a whole person, not just someone with a medical problem. Most people are grateful for the opportunity to talk about what's important to them in life, how and where they want to be cared for if they should become seriously ill and near the end of life. These conversations have found to benefit their loved ones by decreasing stress, anxiety, and depression. Also, when a person's expressed preferences and decisions are incorporated into their care plan, it can result in fewer days spent in the ICU, reduced in-hospital deaths, improved efficiency of care, including increased utilization of palliative care and hospice, as well as sometimes reducing costs by avoiding unwanted care. One of the most critical elements to long-term success is leadership engagement and stakeholder commitment. It requires creating a cultural shift that advanced care planning is everyone's responsibility and a comprehensive approach to build new work processes and redesigning the system in which care is delivered, always to attain the ultimate promise to know and honor preferences and decisions. Another key to success is we begin with the premise that advanced care planning is a process that helps people prepare for future decisions so that when a person's healthcare status changes, these decisions should be revisited as they may and are likely to face changes as a result in the decisions that they make. So advanced care planning is a process. It is not a checkbox or solely a form. This is why we don't recommend setting a single goal for measuring success to be such as increasing the number of advanced directives that are completed and are in the medical record. It means designing workflows to use the electronic health record and other means to not just store advanced directive documents, but also to record the conversations, to record what matters most to people and what leads to the completion of the document, specifically how they can be useful for future healthcare decision-making. Another key component to success requires a commitment to resource allocation, to improve competencies through standard education, through certification, building an interprofessional team approach. It includes training facilitators who have the time and the skills to conduct these advanced care planning conversations. When done well, it will help you achieve the goal to provide person-centered, team-based care. It also means a commitment to equitable access to care. When advanced care planning is used by individuals across diverse populations and across settings where they work, where they live, where they pray, wherever they receive their health care. When healthcare systems and community organizations work together to build strategic partnerships, they are able to collaborate and contribute the resources that are aligned for the greatest success. It's important to create a variety of education and engagement campaigns. Don't start with talking about end of life. Talk about how this type of planning helps people prepare for a sudden, unexpected accident or illness that may leave them unable to communicate, and someone else will need to make decisions for them. Think about advanced care planning initiatives like other public health strategies, such as vaccinations and fall prevention programs. Think about advanced care planning as how it can become the standard of care. There are restraints on time, resources, and budgets in healthcare. And healthcare systems may want to start by focusing their initiatives on people who are living with chronic and serious illness. For example, you might start with outreach to people age 55 and older. You might start by inviting people to participate in advanced care planning as part of their annual wellness visit. Plan to expand your outreach to more population groups incrementally over time. Another lesson we learned during the pandemic is related to workforce retention. We have received many anecdotal examples that facilitators, providers, and team members who are trained to provide person-centered advanced care planning report a renewed sense of meaning and purpose. We hear people say this work has changed them personally and reconnects them to their professional aspirations. Some advice that we would give for someone who wants to start or amplify an advanced care planning healthcare agent initiative is to first talk up the value of advanced care planning, specifically how these services and care improves people's lives. Normalize advanced care plan discussions. Forms and statistics don't motivate people to action. Use positive and aspirational stories from a variety of perspectives and voices. Also, advanced care planning is a process, not a one-time event. Invite dialogue and not just once. The call to action is to start early and talk often. One's choices and decisions typically change as one's healthcare or health situation changes. We would also recommend you assess your program's current state, identify and prioritize gaps and opportunities. We often say start small while thinking big. Change management is complex, and patience and perseverance is essential. The rigor of the work is worth the results.